Welcome to channel AMEC, your insight to the Australian visa system. Good day everyone, my name is Carl Young, your online YouTube visa consultant. Are you interested about migrate to Australia? Why don't you consider to subscribe to our channel and turn on the little bell on the side, so once we have all the updates and news, you'll be the first one of getting all the insights. Now in this video, I would like to take a little introductory to how to become a doctor of medicine. Obviously this topic has been a very timeless topic. A lot of people want to become a doctor. Obviously it's a very good career and profession to be. However, to be a doctor in Australia, perhaps going through study abroad will be a very hard process. So let's jump into the detail and take a look. What I'm going to do today is I'm going to go through a graph which is much easier to understand because without this graph, going through a lot of documentations, it's actually very hard. You can dig that out, perhaps Google, you'll find a lot of information, but this graph will actually show you in chronological order what you're required to do, or perhaps how a Australian doctor can become a doctor. It's gonna be a same procedures. Now looking at this, now obviously a person has to be smart enough, have a good score academically, so you need to go through high school. Now the reason why there is a perhaps a other degree here, the reason why it's at there because some people might not achieve academically sound enough or good enough to actually enter into medical school. So they are required to go through other degrees. So they might go to business or whatever the degree that you choose to be, and you need to achieve a certain GPA in order to actually get into the red part here, medical school. Now obviously when you get into medical school, you start from undergraduate, you go through all the basics of how medical terms and things, all the studies that require, and this can go from undergrad or postgrad, and it's equivalent to 4 to 6 years. So it's not a easy go subject. Of course, to be a doctor is not that easy. Now study and completing all the study is not the end of this. Now obviously you will know all about this because we all know some doctors and they can share their testimony and experiences, but let's take a look of how the Australian system will work. So then after that, you need to go through an internship. So 1 year a hospital intern will rotate through various specialization like surgery, emergency, blah, and then that's 1 year intern. Now once that's done, you move into the next phase, which is residency phase. Now what does it say? At the side here it says HMO, House Medical Officer, and RMO, Resident Medical Officer, and that's basically how in the medical system, Australian medical system, will actually call you at that kind of stage. So each of these stages says many commences research and further training, either out of interest or to get into specialty training program. So in medical there's so many stuff, you want to go into probably part of your skin, brain, intestines, whatever it is. There's just so many. You go to a hospital, that's why the hospital is always huge, because there's just too many things about our body. So you want to like to pick your specialty. Okay, for example, you go into diploma of whatever it is, okay, autonomy and public health and things like that, and then make work and accredited registrar, a more senior position without being a specialty program. So again, this is more about start to get into whatever that interests you in the field of medical, because there's just too many and you need to pick where you want to land yourself in. So the prior academic studies, you can correct me if I'm wrong, because I'm not a medical person, but I'm here basically to digest and introduce the the course, how one can actually become a medical profession in Australia. Obviously, you need to get your academic done, and then you enter into all these intern practices and things. Now, the next phase, all of this from intern to HMO, RMO, registrar are all called junior medical officer. So at the junior medical office, at the next phase will be the registrar. After being accepted in a special training program, so you may become a GP registrar, a medical registrar, surgical, or other. So that really depends on which type of specialty that you wanted to pick. And then furthermore, you go into a fellowship. So basically, you go through with the more senior medical personnel, whatever the specialty that it is. Of course, you go through learning intern and more practices and things. So 1 to 2 years of subspecialty area research, often taken overseas. So some people do go overseas, optional in some specialties. Now, finally, at the very bottom bit is the PhD. Now, this is optional. Some people want to go PhD because they, when they go into research, they might be interested into a certain topic that has never been done before. So obviously, you will write a thesis and publish your article and things like that. And of course, that gets you into a PhD. So a doctor and a PhD. So that's brilliant, but that's optional. Some people might just finishing the fellowship, they probably just enter into workforce. So the workforce will commence here at the bottom bit. Let me just move that out a bit. You may be able to see that better. So you become SMO. That's a senior medical officer, specialist consultant, and that's GP. GP means general practitioners, treat patient with variety of common medical conditions and refer to patient in hospital and other medical services urgent specialist treatment. So GP is traditionally predominantly at the medical clinics where every day people walks around, they get sick, they get ill, they go see a GP, and then GP may, if required, they may refer them to a specialist for further medical treatments. Or perhaps you want to become a physician. That's all type of different categories. So cardiologists, I'm not going to go through all this, there's just too many. And I will be getting more information about how all these are different the topics of courses, what's required, what's to study. And you might want to become a surgeon. Okay, so that's people may choose different parts. And then other specialists, so dermatologists, about the skins, psychiatrists, and things like that. So that's basically the medical education system in Australia. Now, if you're not Australian, obviously, and that's why this channel is all about migrants going to Australia. Now, a couple of ways you can do it. You can study abroad, but you need to, come to Australia as young as you can. As you can see, if we go back to the actual graph here, they started from high school. You need to really start early in order to actually get yourself into that system. Okay, now the reason why is because for medical studies for foreigners in Australia, it's very, very limited. So you want to get into the high school. Now, if you miss out high school, what can you do? Now, the other pathway is you're required there are, I think, 12 universities they can take foreign students, international students, into medical school, but you need to go through a PY, the professional year courses, meaning that prior entering into the actual undergrad, you're required to have a professional year study or 1 year to get yourself prepared into the medical studies. Now, these medical studies obviously there's very, very limited. So every uni, I think every year it's about 2 to 5 places. So it's very, very competitive, and that means if your high school academic performance from your origin country has to be very, very good. Otherwise, you won't be accepted into the PY program. And if you're not accepted into the PY program, you will not be able to enter into medical school of that particular university. Anyhow, what do you think of this profession to become a doctor? Is it good or not? Is it hard? Is it too hard? Why don't you leave a comment right down below, and I see you in the next video. Goodbye.